Well, joining us this morning is the Marketing and Communications Specialist for Titusville Area Hospital, Kelly Clark. Hi, Kelly. How are you?
Hi, I'm good, Luke. How are you doing today?
I'm great. Good to see you this morning.
Good to see you.
I know we're well past the Happy New Year thing, but I haven't seen you since before Christmas, so Happy New Year to you.
Happy New Year to you.
Yeah. The end of the year go okay?
Yes. Yeah.
Good?
Yep. Everything is good. We're still here. We're still going, moving forward. So I brought somebody new that we haven't met yet on the radio show. This is Andrew Gunn. He is a PA with Dr. Charlie Gates in the orthopedic sports medicine at Titusville Hospital.
Andrew, good morning. Good to see you.
Good morning. Thanks for having me.
Well, before we get into it, we want to learn more about you.
Sure.
Tell us everything.
Yeah, so local, definitely. I went to high school at Cranberry High School just south of here. Shout out to the Super Berries. I also went to college local at Clarion University for my undergrad. And then I went on to my master's in Erie, Mercyhurst University. So, I've been Western Pennsylvania my whole life. I'm happy to be here.
Great.
Yeah.
Well, I'm glad you're here. So what stage in your life did you say, but this is, I think, the path I want to take?
Early, definitely. I have an older sister. She's a PA also. So I got to see from her sort of what it was like. And then in high school, I had a couple buddies that got hurt playing sports. So I got to see sort of their rehabilitation process, and I thought it was really cool. So now that's what I do every day.
You didn't cause her injuries, did you?
No, not directly.
Okay, that's good. What do you, like hobbies, what do you enjoy doing?
Yeah, good question. Right now, I just bought a house, so I spend most of my free time working on my house.
Excellent.
When I'm not doing that, in the wintertime, I like to snowboard a lot. And then in the summertime, I golf. I exercise, hang out with friends and family. So
Wonderful. Those are important things.
yeah, good. I enjoy doing them when I have time.
Speaking of golf, Kelly, a little tease?
Yes. So start getting excited. Everyone will be getting their save the date postcards in the mail. So that will be coming up in May 22nd.
Wow.
Very excited. Last year we had to turn away a couple teams. So if you want to golf, I suggest signing up early because I think we're going to have another great turnout this year.
That's wonderful.
Yeah.
It's really a lot of fun, and people continue to talk about it like all summer. So
Yeah, it is. It's a great scramble. Everyone gives us lots of compliments on it. So, every year we tweak small things just to make it run a little bit smoother. So every year it gets just a tiny bit better. So
yeah, it's
Yeah.
fantastic. So now when they get the cards, they can call and register their
they
teams?
can call and register, or they can go online. Actually, the online portal is already set up for this year.
Oh,
so
wow.
you could go on right now and register your team if you wanted to.
When did you officially start having the meetings for the golf outing?
I think December, and made some decisions and kind of got all of our advertising ready to go, and now we're just getting ready to send everything out. So it's
All
pretty
right.
exciting.
Countdown's on.
It
Looking
is.
forward to it. Well, Andrew, for you, what's the day-to-day like for you? Is it different every day?
Yeah, that's one of the best parts of the job, I would say. We see all types of things at Titusville. We see patients in clinic most days, and then we're in the OR other days, and we also see patients on the hospital floor. So it's a good mix of stuff out there.
So what all do you do during the course of the day then?
All kinds of stuff.
Yeah.
I casting, I put braces on people, we do joint injections, whatever they need, really.
What's your favorite aspect about the job?
I don't know. There's a lot of things I like about the job. My favorite thing probably would be post-op appointments. Patients come in and they're feeling better. They have less pain, better function of whatever their issue was, and you can just see on their face like how happy they are and the relief that they have. Because they're entrusting us, with their health, and it's an honor to be able to work, with them on that.
Yeah, and it seems like Dr. Gates is just crazy busy, and I think part of it too, Kelly, is the relationship that he has with the public and having like the lunch and learns.
Oh, yeah. Yes, he's been very involved since he came to Titusville. That was one of his main things he wanted to do, was really get out and meet some people and get the aspect of what the needs are and kind of the feel of the community. And he's loved every minute of it, and he's very compassionate and answers all of their questions and just makes everybody feel very comfortable with him. And I think that's really been something important for for a new doctor here in a small community.
Andrew, for you, it has to be kind of exciting because you said it's just a variety every day, and I mean the demographic of the patient can vary as well. So whether it's somebody's looking at a knee issue or maybe a sports-related injury, there's a lot of opportunities there.
Exactly. Yeah. I mean, we see all types. I mean, I'll see a 12-year-old with wrist pain 1 minute, and then the next minute I'm seeing a 75-year-old with knee pain. I mean, we're happy to see all joint and muscle and bone complaints regardless of age or what it is.
Yeah. So what kind of drew you to Titusville? I mean, obviously there was probably an opportunity, but when you got there and started in working with folks, what's your takeaway?
Yeah, so actually, whenever I was at Mercyhurst, in PA school, part of it is rotations. So you go out, around the local area and work in different hospitals. And I actually did 2 rotations in Titusville. So I got to know the hospital and the staff there, and I really enjoyed it. And it's like a nice, rural, close-knit hospital. So that really drew me to this job.
Yeah, and it sounds like you really enjoy our area, recreational opportunities, people. I'm sure that's a part of it too, right? Just encountering different people throughout the day and having those conversations with them. I'm sure you learn a lot about people.
Absolutely, yeah. I mean, like I said, I've been here my whole life. I have no reason to leave. I'm happy to be here. And sometimes I see people in the office, that know my parents or know other people in my family. So it's nice to give back to the community you grew up in.
Yeah. Well, Kelly, there's a couple other things that you're working on outside of golf. What's going on?
So we were talking about the lunch and learns. We actually have one coming up February 1st at noon in the hospital boardroom. You can go online to sign up for that, or you can go to call me directly at 827-1060. We're offering a free lunch to anyone that comes. Seats are limited, so please register ahead of time. You'll get to meet Dr. Gates. He's going to talk a little bit about what he does at Titusville, what surgeries are available, and kind of a little bit like what Andrew's talking about, the day-to-day and what he does at Titusville.
Excellent.
Yeah.
And again, you can call and register for that? Or?
You can call me directly and register, or you can go online and register. I believe we have a posting on Facebook right now. It takes you right to that link, and you just put your name and number in, and you're all signed up.
Excellent.
Yeah. So we have someone else that's new, Rachel Rubaker. She is our new counselor. She's actually a licensed clinical social worker, but she's offering counseling full-time at the hospital, which really fills a need, especially since she offers counseling to ages 8 and up.
Again, make the phone call to schedule an appointment.
Yes,
okay.
You can schedule an appointment with her by dialing 827-9770 and ask for an appointment with Rachel, the new counselor.
And as the poster says, individual and family counseling.
And family counseling. Yeah, she does a lot of trauma counseling, grief support counseling, anxiety, depression, PTSD. It's kind of a wide scope of different behavioral health issues.
Anxiety, depression, is there an increase? Is it hard to gauge in our area?
Yes,
Okay.
The need is very high for that. We've had an outcry for that service to be filled, especially in youth, adolescents. So her offering those services to 8 and up is really helpful.
Okay. Again, make a phone call and go. And even if you're just thinking, like, I don't know if I'm depressed or anxiety, I mean, call and
talk to somebody.
Yes.
Absolutely. It doesn't mean you have to sign up for the next 30 years of your life. You can call, get some help. And it could be as simple as just talking to somebody, on a short-term basis. And if you need long-term, that's available as well. She also offers telehealth. So if you're at home and maybe you can't get out, especially in the wintertime, and just really need to talk to somebody, telehealth is also available through her.
That's wonderful. Okay. Is that something that, in addition to just calling, I mean, if should these be conversations that somebody's having with their primary care physician?
Absolutely, yes. If you're going to your primary care physician and kind of being treated that way, primary care can offer a lot of different medications for antidepressants, things like that. But if you're looking for something more, definitely talk to your provider and they can point you in that direction for actual face-to-face therapy or telehealth therapy.
Prior to this, where would you have to go to get a service like that?
So, especially for kiddos, Erie, I know they do offer some limited help here through other organizations, but we haven't offered any. And I know Meadville also offers care.
Okay.
But it's a lot of, not that close to home. And if you're going for regular appointments a couple times a week or even once a week to travel outside of the area, especially with kids going back to school and sports and everything, it's pretty tricky. So, offering those
it can be a
close to home
headache,
is helpful.
but at the same time, if somebody needs,
it's definitely a need. Yes. So,
Right.
we're excited to have her. I'll have her on the show soon.
Okay, excellent. Well, just have a conversation or to.
Oh, maybe both. We'll
Okay.
see. We'll see how you do.
Thanks, I appreciate that. Oncology department.
So the oncology department is on schedule with the renovation. We're very excited, looking forward to finishing up that project soon. Hopefully be able to be utilizing it by end of March. Getting ready to put up our donor wall and get that all finalized. If anyone was hoping to be on that donor wall for a donation, you can give me a call. If you've been thinking about making a donation towards that and haven't yet, you can send it to the Titusville Foundation. There's lots of information on our website still about that. So we're coming to a close on that large project. Very excited. I can't wait to see it all done. I've been progressively watching it from nothing to now we have walls and a floor. And
Oh, that's great.
Yeah, it's going to be really great for our patients here.
Okay, so call Kelly and make that check out to who?
Titusville Hospital Foundation.
Okay.
Titusville Area Hospital Foundation. Yep.
Speaking of a check, some money,
Yeah.
Lights of Love.
Lights of Love, yes, it just ended. So our auxiliary at the hospital does a fundraiser every year called Lights of Love. For anyone that's not familiar, you can make a donation in memory of or in honor of somebody towards the auxiliary, and they publish whoever you made your memorial to in the paper. And it's just a really great way to memorialize those that you're thinking about that time of year. And it's great that our auxiliary does it because they do such a wonderful job at our hospital, and it's just one more great thing that they do in the community. So this year they raised close to $6,000.
Wow.
So really great. And what they do with that money is even cooler. So they raise that money and they ask all the departments within the hospital to come up with a wish. Like something that maybe wasn't included in capital, something that broke recently, something that they thought, what would be really great for our patients is this. So hospital departments put forward their wish, and we just had a meeting yesterday, and they go through it and grant all the wishes that they can. So
Oh, that's fantastic.
yeah, so really neat.
All right. Now you'll be thinking about next year.
Yeah, and then we get to do it all again next year.
Yeah,
So
looking forward to
yeah,
it.
it's fun.
You're watching The Morning Drill on Stream Television and on Armstrong's Neighborhood Channel. We have Kelly Clark and Andrew Gunn with us here this morning. Well, Andrew, how much has changed just in the time you've been out of school? I look at the situation with like Aaron Rodgers and some of what he's gone through, and I'm like, boy, it's incredible what the human body can achieve, along with a great medical staff, obviously. But have you found a lot has changed even since you graduated and come into the workforce?
Yeah, so I actually just graduated last year, so I haven't been out of school that long. But even whenever we're in school, our textbooks change, within the month. I mean, we medicine is ever changing, which makes it so interesting and so fun and different every day. But yeah, I mean, what Aaron Rodgers was able to accomplish was pretty impressive. He didn't get back to the season, but making a recovery that quickly is impressive regardless. But yeah, I mean, it's nice to see how quickly medicine changes, and it's fun to implement that with patients.
Yeah. Does that set maybe an unrealistic expectation, or not really? Is this where medicine is going? Like, it is getting better. Technology, the rehabilitation side. I mean, everything just seems to be like light speed, really.
Sure. It might set an unrealistic expectation in some cases. I mean, it's a patient-by-patient case, as
Yeah.
always. But yeah, I mean, I think people might be surprised, how much of recovery they might make, with the new technology we have in orthopedics.
Does that excite you? Just again, knowing like every day something is different on that front.
Yeah, I mean, I'm happy with, the things we're able to offer our patients now, and I'm excited to look to the future with what we'll be able to offer them in the next 5, 10, 20 years. I mean, it's just going to get better.
Kelly, the process of getting in front of Dr. Gates, is that again through your primary care physician, or how does that process work?
So mostly through your primary care physician, but you can reach out independently. So, if you want to just maybe have a consult with him, see what he thinks, he could definitely take a look. It's really based on insurance, how to make those appointments. And the girls that physician services, when you call, would know how to go about that. So if you have any questions, or maybe you haven't been to the doctor for a while and are having a lot of pain, definitely come in for a consult. Or you can also come to our Lunch and Learn on February 1st and meet Dr. Gates.
And you can ask some questions.
You can, yeah. Everyone asks a lot of questions. So he does a presentation in the beginning, and then it ends up being like a lot of question answers, and it kind of is fun because you don't really know what's going on and what people are going to ask, and it turns into a lot of different questions for everyone there. So it's a good time.
Andrew, I'm sure you get a lot of questions from patients. What sort of things seem to be repeated over and over?
Well, I mean, the main thing we're offering right now is a total knee replacement. So a lot of people ask, like, when do I know if I need a total knee? When do I know if I need this surgery? And the fun thing about orthopedics is, it's not like a cardiologist where you have to take this or you might have some bad outcomes. I mean, it's really just when you're tired of the pain or tired of the decreased function, come see us. I mean, whenever you're ready, you're ready.
So you mentioned sports injuries and the high school or younger coming to you. What sorts of things do you typically deal with when it comes to, and I realize there's a ton of injuries for sports, but locally, what do you see a lot of?
Sure. So, I mean, we see a lot of like rolled ankles in basketball and volleyball and things. You might see some like rotator cuff tears in young throwing athletes, some shoulder dislocations, things like that. I mean, but really we're happy to see anything, of course. But those are the main ones we see a lot of.
Okay. So really, if you're, and we'll start at that age group, if you're feeling discomfort from an injury that happened in sports, and you have questions, they can call and have an appointment. And
yeah, our nursing staff does a great job on the phones, directing patients to what would be most appropriate. And then, if it's deemed that they should come and see us, I mean, we're happy to answer. We're happy to evaluate them and answer all their questions.
Yeah. Knee replacement. This is something where, again, the technology has just, it's been incredible over the years, the last decade. Do you get people that come to you and think, they ask you questions based off of information they may have heard 5, 10 years ago?
Yeah, definitely. Especially me and Dr. Gates here at Titusville. We offer a conformist total knee, which is a nice technology. It's patient-specific cutting guides. So if you come in and you need a total knee, we'll get advanced imaging of that knee, and then we send it off to Conformist, the company, and they make 3D printed models that we can only use on your knee in the OR. So I mean, even just stuff like that gives patients a lot better outcomes, and we're happy to offer it here in a small rural setting.
And that's unique, Kelly. And maybe you can dive into this real quick. Before or in other places, you can get the basic.
Yeah, so they call them off-the-shelf knees, and basically they have multiple different sizes, and basically what they'll say, this is probably going to be the best fit for this person, but just like a tailored suit, a size 34 isn't going to fit everyone the same exact way, and if you were to get a tailored fit, it would fit a little bit better, and that's the way knees are too. So you can get the conformist knee, which is 100% custom, and like Andrew said, they take a CT of your knee and they can build you one that's just for you, specific just for you, that would fit nobody else.
That's incredible.
Yeah, and so Dr. Gates looks at that and sees if that's something that's a need for you. To kind of give you a better outcome. A need.
Very
Nice.
nice.
Yeah, thank you.
I'm going to use that.
No, don't. That's horrible. But that's pretty unique. That's cool.
Yeah. Yeah. So in this area, no one else offers that. No one else offers conformist right now. But it is probably going to be the new wave of the future, just to, really offer better outcomes.
So if I came in, Andrew, today, and that's the way it went, how long is the process? And I realize it's probably different for everybody, but I could have my new knee and out in rehabilitation in how long?
Sure. So say you came into the office today and you had a real bad knee, we'd get that CT scan ordered. That's the first step. Once we get the CT scan back, we'd send it off to conformists. It takes them about 4 to 6 weeks to make those patient-specific cutting guides and send them back to us. So you're talking like almost 2 months from the time we first see you to where you'd have your surgery, depending on OR availability. And then, you're
Pretty
walking.
good.
Yeah, so it's a pretty quick turnaround that way. And then, you're walking the same day. So after we get your knee done, it's really just as quickly as you can make the physical therapy milestones. So realistically, patients usually, you're talking 3 to 6 months before you're back fully doing everything you want to, but you're able to walk immediately.
Get scheduled now and enjoy summer.
Yeah.
Mm-hmm.
That's right. So,
Yeah.
Andrew, nice to meet you. Congrats on everything and best of luck.
Thank you. Nice
Kelly,
to meet you.
great
Thanks,
seeing
Rob.
you again.
Good to see you.
Always bringing great people and
Yep.
lots of wonderful updates on everything that's going on.
Yes. Thanks for having us. We
Any
appreciate it.
questions, they can call the hospital.
They can call the hospital. Absolutely.
Okay.
All
Thanks.
right. Thanks, Luke.
Take care.
Thank you.